muscle. Then look at this, next name. Levator Palpebrae Superioris. So that's the muscle that raises the upper lid. So it makes your eyes really nice and wide. So its attachment, its origin is actually the lesser wing of the sphenoid bone just above the optic foramen. Whoa, 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 whoa. That's a long sentence. That's all the way back here. If you see a cross section here, that's all the way back here. Remember, the sphenoid is the bone that goes from temple to temple, straight through the skull. That's the sphenoid. So it has those two little wings that come out from the inside of it. And those, the lesser wing is where this levator palpebrae superioris muscle is attached. And then it inserts into the skin of the upper eyelid. It elevates and retracts the eyelid. This muscle is not innervated by that cranial 7. This is the one that's innervated by cranial 4, which we don't have to worry too much about. But what's interesting is when you see somebody has a drooping eyelid on one side, that's known as ptosis, and that indicates that that nerve is damaged. And so that can be an indication that you can see on the outside of what's going on the inside. So that might be interesting. And then this, I swear, this is the most crazy name, and so after that it's downhill. Levator Labii Superioris Alaquae Nasi. Nice. Alaquae means wing or ala of the nose. Okay. So this is the longest named muscle in the body. It means lifter of both the upper lip and of the wing of the nose. It's attached to the it's actually a small muscle. It's attached to the maxilla, and it goes into the skin of the nostril and the upper lip right here. And so what it does when it contracts, it dilates the nostril, elevates the upper lip, and makes you snarl. So a much better name for that is the Elvis muscle. Levator Labii Superioris Alaquae Nasi. Nasalis muscle. This is much easier. The nasalis muscle is the muscle that's in the bridge of the nose. Actually in the center, sandwiched in between the other one, that levator Labii Superioris, whatever that was called. This one, Alaquae Nasi. Okay, but that muscle is attached to the maxilla and inserts in the bridge of the nose. It compresses the nasal cartilages and raises and flares the nostril. It's the nostril raiser. I put this up here because the long-nosed monkeys, they were in Borneo when I was in Borneo, and they look so funny. They have long noses. But anyway, Nasalis muscle. And then we have Levator Labii Superioris muscle. And that muscle is, look at what, now these are muscles that are interesting because sometimes you look at the name and it gives you away what it does. And sometimes you look at the muscle name and it tells you where it attaches. And sometimes you look at the muscle name and it tells you how it looks. And so this one says Levator Labii Superioris. So levator means elevate, Labii means lip, and superioris means above. So this is a lip raiser of the upper lip raiser, right here. So it's attached right here, at the bottom of the, well, it's a cheekbone, and the maxilla, and then the skin of the, and the muscle of the upper lip. So it raises the upper lip. So it looks complicated, but when you take it apart, it's not that complicated. So one of the things in anatomy that you have to do is you have to slow things down and not look and glance over everything so fast. That's often what we do in this culture. We go very, well, in our Western culture particularly, we go very fast with everything. So we got to just slow everything down a little bit. And then we go to the smiling muscle. That's the Zygomaticus, major and minor. There's two to them. We don't worry about them being two. We just have one when we label them for us. But it's like right here. That muscle goes from the zygomatic bone, the cheekbone, and into the skin and the muscle, the corner of the mouth. And it raises the lateral corner of the mouth and makes us smile. We all know that, hopefully. And then the Buccinator muscle, that's the dimpler. So that's, if you ever wondered what makes dimples on the side of your cheek, now you got the answer. It's the Buccinator muscle. It's attached to the maxilla and the mandible, the upper and lower jaw bones, back in the molar regions, and it goes and inserts into the next muscle that we're going to talk about, one of the next muscles, and that's a round muscle around the mouth, the kissing muscle. That's called the Orbicularis Oris muscle. See again, Orbicularis, orbit means round, so that's a round muscle, Orbicularis. And so that muscle draws the corner of the mouth laterally, it compresses the cheek. So what it helps us with holding food between the teeth and during chewing, but also this muscle is very well developed in nursing infants. And if you actually check the cheek size of the nursing infants, it's like you have a tube and a vacuum cleaner. It's like very, very strong. These muscles are very, very powerful in a nursing infant. There we go. Depressor Anguli Oris muscle. Lip corner depressor. So it depresses the corners of the lip. So it's attached to the body of the mandible down on the bottom, and it goes into the skin and the muscle at the angle of the mouth, and it pulls the corners of the mouth downward and laterally as in a tragedy mask grimace. So this is the smile antagonist. And in muscles you have, since muscles only contract, you're always going to have a muscle that does the opposite of what that muscle did. And so you always have one, like in an arm, you have one that makes one that bends the elbow, and you have one that straightens it back out. So if the one that bends the elbow is the agonist, it's called the agonist, or we call it the prime mover. The one that does the opposite motion is called an antagonist. So the word ant is often opposite, or a is often an opposite of something. And so the depressor anguli oris muscle is the antagonist of the Zygomaticus muscle. So the lip corner depressor is the antagonist of the lip raiser, corner raiser. That's the opposite motion. So there you go. Depressor Labii inferioris depresses the lips, so it's a pouting muscle. So it's attached to the body of the mandible on the bottom here. Right here, lateral to the midline. That one. And it goes into the skin and the muscle of the lower lip, and it draws the lower lip down as in pouting. Mentalis muscle is a chin wrinkler. It's a weird one. The origin is the mandible below the incisor, and the insertion is the skin, the chin skin, the skin of the chin. It raises the chin and protrudes the lower lip, and it wrinkles the chin. That's what it does. So it's the chin wrinkler, is the mentalis muscle. Doesn't mean you're mental. The Risorius muscle is an interesting name. So that's actually a little muscle sliver over the Buccinator. So its origin is the lateral fascia associated with the Masseter Muscle. We'll talk about the Masseter Muscle. That's an up and down muscle that helps us chewing. That's a strong muscle. It's a strong action muscle. And then this one goes, the Risorius goes into the skin at the angle of the mouth, and it draws the corner of the lips laterally. It tenses the lips. So it's a lip tensor, a lip stretcher. And then the platysma is the front of the neck up to about the collarbone muscle. So it starts at the fascia of the chest, down here actually, that's where it starts, and then it goes in and reaches around and goes in the lower margin of the mandible and the skin of the lower mouth. And it helps depress the mandible and pulls the lower lip down. Now we get to the Orbicularis Oris muscle. That's the kisser. It's one of my favorite muscles. Of course. So that arises indirectly from the maxilla and the mandible, and encircles the mouth, and it closes the lips doing so, when it contracts. It also tightens the lips. It presses the lips together. It's a lip funneler. A person protrudes the lips is a kissing and a whistling muscle. Whew, does a lot of stuff. This now brings us to the last four. And now we're moving into the muscles that help us with chewing. We have two on the outside that we can easily see, and then two are kind of goofy on the inside. We'll talk about those secondly. The temporalis muscle we've already talked about before in the skull. We have a muscle that comes here from the temporal fossa, superior temporal line area, and reaches down into the coronoid process of the mandible. And that closes the jaw, and it pulls it up like this force shows, these arrow shows. It gives you pain patterns. This is a trigger point jaw. It gives you pain patterns in the teeth. So, since that's the force of pull. So we can have trigger points that we work on all around in here, and they can relieve toothache pain that is not a toothache per se. That is more a muscle related or referred pain. So that's one of them. The second one is the masseter muscle. The masseter muscle starts at the zygomatic arch and the maxilla. There, right there. These two. And it goes into the angle and the ramus of the mandible down in here. And it closes the jaw. Also, it pulls it straight up. So now you got a muscle that pulls it from that angle. We got a muscle that pulls it from that angle. That's powerful. And now let's go to the last two. We have two, they call them the pterygoid muscles. Because they come from the pterygoid processes, these things that reach down. Where are they? Well, you can sort of see where this red one attaches in, but these are processes that reach downward in the back of the roof of the mouth on the sides. They are part of the sphenoid bone, as we discussed. So the medial pterygoid is actually, if you visualize it, it's a muscle that's on the inside of the mandible, where on the outside we have that attached right here going downward. That's the masseter. On the inside we have the medial pterygoid. So it's almost like the mandible is sandwiched into these two muscles. So the medial pterygoid is a very strong closure of the mouth as well. It's attached to the lateral little pterygoid process of the sphenoid bone, the maxillary palatine bone as well, and then it goes into the medial surface of the mandible near its angle down in here. Closes the mouth. And now we get to the last little one, and then that's it for the facials. You're very brave staying in here with me. And this is here. You can see it right here, these arrows. And that's the lateral pterygoid. It's on the outside compared to the medial one. And that comes from the greater ring of the lateral pterygoid plate, the sphenoid bone, and goes into, what's more important here, the condyle of the mandible. Right in here. It goes right in here. And so when that contracts, what it does, it pulls the jaw forward. And what that does, it protrudes the jaw. That's called protruding the jaw. And what that does, it helps the opening of the jaw. And so the three muscles, the temporalis, the masseter, and the medial pterygoid, are closing the jaw, and the lateral pterygoid is opening the jaw. All right, well, that's it for these facial muscles. Let's see what comes next. But let's take a break first.